Hello and welcome. Series 2 of this training will cover participation requirements for providers who are enrolled in the New York State Vaccines for Children program. The New York State Immunization Information System, otherwise known as NYSIIS, is an online immunization registry used by thousands of healthcare providers in New York State to report immunizations. The New York State Legislature passed the Immunization Registry Law, which as of January 1, 2008, mandates all healthcare providers to report all immunizations administered to persons less than 19 years of age, along with the person's immunization histories, to the New York State Department of Health using NYSIIS. Although it is not required by law to report immunizations for adults ages 19 and older to NYSIIS, it is strongly encouraged and a best practice. Adults must consent to allow their immunizations to be entered into NYSIIS. This consent may be obtained verbally, and is only required one time. Many other required VFC programmatic activities are conducted using NYSIIS, including provider enrollment and annual recertification, entering administered immunization doses, vaccine inventory management, and more. As mentioned on the previous slide, New York State Public Health Law Section 2168 requires that all doses of immunizations administered to children under 19 years old be reported in NYSIIS within 14 days of administration. Information may either be manually entered into NYSIIS or uploaded from an electronic medical record, EMR. The New York State VFC program requires that the patient's eligibility status be recorded in NYSIIS with each dose that is administered. VFC providers place orders for publicly funded vaccine and manage their public vaccine inventory through NYSIIS. Vaccine orders will not be approved unless doses administered data and VFC eligibility information are up to date in NYSIIS. The NYSIIS inventory module can help providers order sufficient vaccine supply for their patient population. This module can also be used to report and/or return expired, spoiled, and wasted vaccine. Doses administered in expired, spoiled, or wasted vaccines that are correctly reported in NYSIIS will automatically decrement from the provider's inventory. Recently received shipments of vaccines and their corresponding lot number and expiration date information are added to NYSIIS inventory by using the accept order function to populate inventory. Public vaccine inventory must be complete and up to date in NYSIIS before provider vaccine orders will be approved. To gain access to NYSIIS, you'll first need a New York State Department of Health Health Commerce System account, otherwise known as HCS. Once you have an HCS account, you can request access to the NYSIIS application via the contact information located on this slide. It should be noted that all applicable NYSIIS trainings must be complete to receive access to NYSIIS. VFC providers are required to screen and document eligibility status for patients at each immunization encounter. Determining eligibility status can sometimes be a confusing concept to staff. The following slides may be used as resources to help clarify VFC eligibility. Please consider printing the PDF version of these slides to have on hand. Providers may use their practice's paper or electronic system to document eligibility, but they must enter eligibility status for each dose administered into NYSIIS. Additional guidance and tools for assessing patient eligibility for publicly funded vaccine and trainings on the use of NYSIIS are available via the links provided on the resource document included with these trainings. This slide displays a chart showing the types of publicly funded vaccines available through the New York State VFC program. To receive publicly funded childhood vaccines, a patient must be a child under the age of 19 who meets one or more of the eligibility criteria in this chart. To clarify, patients may be 18 years old to receive VFC vaccine if otherwise eligible. These vaccines can be ordered and administered by providers enrolled in the VFC program. As you can see, funding type varies, and therefore it is required that VFC providers indicate the specific VFC eligibility status – Medicaid, Medicaid Managed Care, Child Health Plus, uninsured, underinsured, or American Indian or Alaskan Native – so that the New York State Vaccine Program can distinguish the funding source. Providers must use their privately purchased supply of vaccine for patients not eligible to receive a public dose of vaccine. Intentional administration of publicly funded vaccines to non-eligible patients constitutes fraud. On rare occasions, and only with prior permission from the New York State VFC program, a provider may be allowed to borrow from VFC stock and replace the doses with private stock. We will discuss vaccine borrowing in further detail later on in this training. Providers must correctly document the specific VFC eligibility category listed on this slide in the patient's electronic health record or paper chart and in NYSIIS. To clarify, for providers using electronic health or medical records, EHRs or EMRs, you should ensure that your data is properly exchanging with NYSIIS. It should also be noted that Medicaid and Child Health Plus, also known as CHIP, are not the same. VFC eligibility must be verified in real time at each immunization visit. Insurance cards do not specify if coverage is through Medicaid, Child Health Plus, or if an insurance plan covers the cost of vaccines. For example, a popular misconception is that Fidelis is always a Medicaid plan, but Fidelis also has Child Health Plus plans. The insurance provider must be contacted for each immunization encounter, either by phone or through a computer-based system to determine specific eligibility status. Once the specific eligibility status has been verified, the office should have a system in place to relay that information to the vaccine administrator or the person who is entering the immunization information into the provider's electronic health record or into NYSIIS. This is separate from billing. This ensures that the New York State VFC program receives this required information with each immunization administered. The term VFC does not apply only to those with Medicaid or Medicaid managed care coverage. There are several eligibility categories, which we will discuss in the next few slides. For starters, Child Health Plus, or CHIP, is not the same as Medicaid. Child Health Plus vaccines are available through the New York State VFC program, but are purchased with funds from the New York State CHIP program. Providers are required to indicate Child Health Plus's eligibility status for these patients, as indicated in your provider agreement. Underinsured means the patient has health insurance, but the policy either doesn't cover any ACIP-recommended vaccines, doesn't cover all ACIP-recommended vaccines, meaning underinsured for the vaccines not covered, does cover ACIP-recommended vaccines, but has a fixed dollar limit or cap on vaccines. The child is considered underinsured once the fixed dollar amount is reached. Providers must verify whether a child's insurance plan covers ACIP-recommended vaccines before vaccine administration. If you cannot verify vaccination coverage, the child is considered insured and not eligible to receive VFC vaccine at that encounter. It should be noted that, as required by the Affordable Care Act or ACA, insurance plans offered through the health insurance marketplace are required to cover all ACIP-recommended vaccines without charging a deductible, copayment, or billing coinsurance. For this reason, there are very few underinsured patients. The American Indian Alaskan Native AIAN status should not be selected based solely on race information collected by the provider. In most circumstances, if AIAN is selected as the VFC eligibility category, the patient will likely have supplied supplemental identification. AIAN children are VFC eligible under any circumstance. If an AIAN child fits a secondary VFC eligibility category, the provider should choose the category that will cost the least for the family. If a child has private insurance, non-exempted under the Affordable Care Act, or is enrolled in the Children's Health Insurance Program, also known as CHIP, vaccination through these programs may have fewer out-of-pocket costs. If the AIAN child is also Medicaid eligible, Medicaid should be used for the administration fee. Children who have a private primary health insurance plan with Medicaid as their secondary insurance are considered VFC eligible. There are two billing options in this situation described on the following slide. The option most cost-effective for the family should be chosen. This slide covers the scenario in which Medicaid as a secondary insurance is the VFC eligibility category. There are two options for billing. The option most cost-effective for the family should be chosen. A child who has Medicaid as secondary insurance and a high-deductible insurance plan as primary insurance that requires the parent to pay out-of-pocket for vaccines is considered VFC eligible if the deductible has not been reached. The vaccine administration fee should be billed to Medicaid. A child with a high-deductible insurance plan who does not have Medicaid as secondary insurance is not VFC eligible. VFC providers must maintain all records related to the VFC program for a minimum of 3 years, even if you were to unenroll with the VFC program. Please note that these records may be retained digitally or electronically. Examples of VFC records include patient screening and eligibility verification records, temperature logs, downloaded temperature data from a digital data logger, vaccine ordering records not recorded in NYSIIS, VFC training records, vaccine management plans, annual provider recertification forms, and medical records that verify administration of vaccine. Medical records showing verified administration of vaccine must contain all of the following elements: the name of the vaccine that was administered, including the vaccine manufacturer and lot number, the date the vaccine was administered, the date the Vaccine Information Statement, or VIS, was given, the VIS publication date, the name and title of the person who administered the vaccine, and the address of the clinic where the vaccine was administered. These records should be made available upon request. The VFC program requires that vaccine storage units are large enough to store vaccines and water bottles without overcrowding. Some pharmaceutical-grade storage units indicate to not use water bottles. Always refer to the product user guide for clarification. Only standalone storage units are allowed for vaccine storage. A standalone unit is a unit that is only a refrigerator or only a freezer. Combination refrigerator-freezer units and dormitory or bar-style units are not allowed. Dormitory and bar-style units are small, single-door combination refrigerator-freezer units that pose a significant risk of freezing vaccines. Certain pharmaceutical-grade combination storage units may be permitted. Please contact the New York State VFC program directly if you are unsure if your storage unit is allowed under VFC policy. Please refer to the New York State VFC program Storage Unit Purchasing Guidance document found in the resources document included with this training. The temperature ranges of refrigerated and frozen vaccine storage units are included on this slide as a reference, but always refer to the vaccine package insert for specific vaccine storage and handling requirements. VFC providers must have calibrated, continuous temperature monitoring devices called digital data loggers, or DDLs, in all storage units that hold publicly funded vaccine. Providers are required to document minimum and maximum temperatures once per day for all vaccine storage units housing publicly funded vaccine. Ideally, this is done when the office first opens for the day. Providers are also required to have at least one backup calibrated DDL in case of equipment failure or for use during recalibration of their primary temperature monitoring devices. The backup temperature monitoring device should be stored outside of the storage unit until needed. Additional information on temperature monitoring equipment and calibration is covered in trainings number 7 and 8 of this training series. The New York State VFC program requires that providers report all non-viable publicly funded vaccine in NYSIIS on a monthly basis. In addition to reporting non-viable vaccine, the New York State VFC program also requires that VFC providers return spoiled or expired product that is in its original vial or prefilled syringe to the CDC's centralized distributor, McKesson Specialty. Vaccine vials or syringes that have been damaged or opened should be reported in NYSIIS, but they are not eligible to be returned and should be discarded as medical waste. Additional information on this requirement can be found in training number 13, Managing Returns and Wastage. A temperature excursion is an event in which vaccine is exposed to out-of-range temperatures. Any out-of-range temperature, regardless of duration, is considered a temperature excursion and must be reported to the New York State VFC program the day it's discovered. Examples of events that can cause temperature excursions include power outages, equipment failures, and human error. It is required that VFC providers report all vaccine temperature excursions to the New York State VFC program on the day it is discovered by completing Part 1 of the Vaccine Temperature Excursion Form and submitting it along with the digital data logger download to vaccinetempexcursion@health.ny.gov. The VFC program is often able to quickly determine if the vaccine is still viable. In some cases, the provider will be directed to contact the vaccine manufacturers directly to determine vaccine viability. After contacting the manufacturers, the provider would then fill out Part 2 of the excursion form and submit to the VFC program. If any of the vaccine is deemed non-viable, any return-eligible products should be returned to the distributor by utilizing the Manage Returns and Wastage module in NYSIIS. As indicated in the previous slide, broken vials or syringes, or open multi-dose vials of vaccine may not be returned and must be recorded as wastage. Excursions that occur due to staff negligence and/or excursions that have gone unreported may result in provider responsibility for restitution of non-viable vaccine. The New York State VFC program has a vaccine restitution policy requiring VFC providers to provide financial restitution in situations in which publicly funded vaccine is deemed non-viable due to provider negligence. Standard population size VFC practices, eligible patient population greater than 50, will be allowed a 5% allowance towards wasted vaccine annually, while small population size VFC providers with eligible patient populations less than 50 will have an annual wastage threshold of 10%. Vaccine wastage is calculated for a 12-month period as follows: the number of vaccine doses wasted, expired, or spoiled, divided by the number of vaccine doses ordered. Providers who lose vaccine due to uncontrollable circumstances such as power outage or unforeseen equipment failure will not have those losses counted against their wastage allowance. Refer to VFC trainings on vaccine storage and handling in this training series for best practices for decreasing vaccine wastage. Each VFC provider is required to have a vaccine management plan, part of which includes a routine vaccine storage and handling plan and an emergency vaccine storage and handling plan. The routine plan should cover routine tasks associated with the storage and handling of vaccine. The emergency vaccine storage and handling plan should include information and instructions in the event of an emergency such as equipment failure, power outage, or natural disaster. These plans should be reviewed and updated annually. Additional information on vaccine management plans is covered in training number 3 of this training series. Vaccine information statements, or VISs, are information sheets produced by the CDC that explain both the benefits and risks of a vaccine to its recipients. The National Childhood Vaccine Injury Act of 1986 requires all healthcare providers to give patients or their legal guardians the most current VIS just prior to the administration of each dose of vaccine. The most current VISs can be found on the CDC website at the link on this slide and on the resource document included with this training. You can also sign up for email updates on any time there is a change or update to a VIS on the CDC website. VISs are available in 41 additional languages. The Immunization Action Coalition also has a printable listing of the most current VIS dates. Check the dates on the VIS handout against this list and update as needed. VFC providers must document the following VIS information in the patient's medical record: the specific VIS given, the VIS publication date, and the date the VIS was given to the patient or the patient's legal guardian. It is important that you are distributing the most up-to-date VIS sheets. Vaccine administrators should verify the publication dates they are documenting in the patient's record reflect the dates on the VIS provided. Using cheat sheets for convenience can lead to outdated VISs given, and you cannot assume that these are the most up-to-date VIS publication dates. Be sure the VIS dates in your electronic health record match the publication date of the current VIS provided. Updates to VIS dates should be updated system-wide, and outdated publication dates should be removed as options from the electronic health record to minimize selection errors. VFC providers must immunize children eligible for publicly funded vaccine at no charge to the patient for the cost of the vaccine. VFC providers may be able to receive an office visit fee and a vaccine administration fee depending on the eligibility category through which the children qualify for the program. The categories and related vaccine administration fees are displayed in a table on this slide. VFC providers must not deny administration of publicly funded vaccines to any eligible child due to the inability of the child's parent or guardian to pay the vaccine administration fee. If the parent or guardian cannot pay the administration fee for a publicly purchased vaccine, the provider must waive the administration fee. Unpaid administration fees may not be sent to collections, and the provider may not refuse to vaccinate an eligible child whose parents have unpaid vaccine administration fees. Healthcare providers must not refer Medicaid and Child Health Plus members to other sites such as public health clinics for their vaccines. Healthcare providers who inappropriately refer patients or attempt to force collection of administration fees from patients will be prohibited from participating in the Medicaid and CHIP programs. VFC providers are expected to maintain adequate inventories of vaccine to administer to all privately insured patients and patients receiving publicly funded vaccine. Borrowing can occur only when there is a lack of vaccine due to unexpected circumstances, such as a delayed vaccine shipment, or the vaccine was spoiled in transit to the provider. Publicly funded vaccine cannot be used as a replacement system for a provider's privately purchased inventory. Borrowing vaccine must not prevent a VFC-eligible child from receiving needed vaccination because the publicly funded vaccine was administered to a non-eligible child. VFC providers must request prior approval from the New York State VFC program to borrow any vaccine in the rare event that the need to borrow arises. To request approval, VFC providers should contact the VFC program directly to discuss the specific circumstances of each request. All instances of borrowing must be properly documented, reported, and have doses replaced within 30 days. A vaccine borrowing report must be completed when privately purchased vaccine is administered to a child eligible for publicly funded vaccine. The form is linked on this slide and available on the resources document included with this training. VFC providers must participate in site visits conducted by the New York State VFC program staff. Site visits are conducted to assess provider compliance with the laws, policies, and recommendations of the New York State VFC program, as well as the Advisory Committee on Immunization Practices, otherwise known as ACIP. The enrollment site visit is a one-time site visit following VFC program enrollment to certify that the provider has the capacity to adequately store and administer vaccine to eligible children. A VFC compliance visit is conducted to assure that VFC providers maintain compliance with program requirements such as eligibility screening, maintaining records of eligibility, and adhering to storage and handling requirements. These are conducted within 12 months of initial enrollment and every 18 to 24 months thereafter. VFC unannounced storage and handling site visits are conducted as needed to follow up on storage, handling, or accountability issues noted during a previous site visit or based on other concerns related to the provider's ability to meet program requirements. As the name suggests, providers are not notified about these visits before the visits are conducted. The VFC program reviewer will discuss visit findings with the provider staff during the site visit. Following the visit, the provider will be required to submit follow-up corrective actions for any compliance issues identified. If necessary, follow-up site visits may be scheduled to ensure timely corrective actions are taken. The New York State VFC program has policies in place to prevent, identify, and investigate suspected cases of fraud and abuse of publicly funded vaccine. Some examples of potential fraud and abuse are denying VFC-eligible children VFC-funded vaccine because of the parent's inability to pay the administration fee, billing a patient or third party for VFC-funded vaccine, failing to implement provider enrollment requirements for the VFC program, providing VFC vaccine to non-VFC-eligible children, and wasting publicly funded vaccine. As covered previously, the vaccine restitution policy holds VFC providers responsible for replacing any publicly funded vaccines that are deemed non-viable due to provider negligence on a dose-for-dose basis. To report suspected cases of fraud or abuse, complete and submit the New York State VFC Fraud and Abuse Referral Sheet found on this slide to the VFC program at nysvfc@health.ny.gov. This can also be found on the resources document included with this training. Thank you for participating in this training on VFC provider program requirements. Any questions can be sent to nyvfc@health.ny.gov.